Hello, I am Cindy Rubin. I am owner and founder of In Touch Pediatrics and Lactation, a breastfeeding and general pediatrics practice in the Chicago suburbs. And you are watching Keeping in Touch, a weekly show with dabbles of this and dabbles of that, and talking to local businesses and experts in their field to get to know the DPC and breastfeeding and pediatrics space. So this week we have Dr. Natasha Diaz, who is owner of Roots Health DPC, which is a DPC practice in Forest Park, Illinois, near me, and that is how we have connected. And we're going to hear a little bit about her business and how she got to where she is. But I'm going to let Natasha, Dr. Diaz, introduce herself.
Hi,
Welcome.
thanks for having me, Cindy. I really appreciate it.
Absolutely. Thanks
I'm
for
Dr.
coming on.
Natasha Diaz, Roots Health Direct Primary Care here in Forest Park, and I'm so grateful and honored to be here today.
Well, I'm very happy to have you. And I'm really interested. So, I am practicing so DPC stands for direct primary care. And those of us in pediatrics are kind of taking it over and calling it direct pediatric care. And the reason I bring that up is because pediatric practices are a little bit different than family practice DPCs. And the family practice docs are the ones who really created this movement and this model of care, and are like perfectly situated to care for the whole family in practices like these. So Dr. Diaz, I would love to hear kind of how you found your way to DPC, and then we can talk a little bit about your DPC in particular and its nuances.
Thanks. Yeah. So I went to University of Illinois in Chicago Medical School after completing my undergrad at the University of Illinois in Champaign, where I studied the healthcare system and created a major in women's health. And I actually decided at that time that the healthcare system needed to be revamped. It was clearly not good enough for me back then, way back in the 90s. So I went to medical school thinking, oh, well, I'll just get an MD and everybody will understand and we'll fix the system and it will be easy. And I finished medical school. I ended up choosing family medicine because I loved all my interactions with all the patients. I loved being in the operating room. I loved the kids. I loved the babies being born. I loved the maternity care. I remember being in an obstetrician's office and they didn't know how to handle the asthma of the patient that was pregnant. I remember being in the internal medicine doctor's office and they didn't know how to do the heart tones when the patient was pregnant. And so I just thought, well, this is like, I like to be able to do it all. And I wanted to do it all really well. So I actually trained out in San Francisco, outside of San Francisco, in a program called Contra Costa County Hospital, where I got really broad training. So from day one, they sort of handed me the knife and said, cut here for an appendicitis or a C-section. And really, it's actually modeled after the British registrar system. So this is, I guess, the way they do it in England. But just really like a direct mentorship with family medicine docs who had gone before and sort of subspecialized themselves into becoming the gynecologist, the ER doc, the surgeon. And so that is sort of
Wow.
where I started out in the West Coast. And when I finished training, I was confident with my ICU skills. I ended up working in a rural emergency room in Northern California in a town called Colusa, where I would do a 24, 48, or 72-hour shift, and I would be the only one there. Yeah, I'd do cardio versions, put them on a plane. I mean, it was the way it was. And I was really comfortable doing C-sections. So when I moved back to Chicago, I actually chose to work at West Suburban with a nonprofit organization called PCC on the west side here, where I would be able to continue to utilize those surgical skills for obstetrics. And I continued doing C-sections. And I cut back on a lot of the, other surgical stuff. I ended up doing a lot of outpatient family medicine work, seeing adults and kids. And yeah, and over the years, I really still felt a little bit crunched with time in the room. I felt that I didn't have the amount of time that was needed for patients to really be able to take care of them in the way that they needed to be taken care of. I felt like in 7 minutes, which is the average visit
Yeah.
time, I could, address how to adjust their meds for their diabetes, but I couldn't necessarily adjust their lifestyle or look at changes in their lifestyle or diet changes or exercise changes or really kind of get to the root cause of what was going on with the patient that was making them have conditions that were probably preventable at one point, definitely treatable now, and still to be able to get patients to engage, you need more than 7 minutes.
Yes,
And so
absolutely. Yeah.
yeah, that is sort of how I journeyed into direct primary care. I wish I could tell you when I first heard of it. I don't remember, but I know as soon as I knew about the model of care, it was really clear to me that that was going to be the way that I feel that healthcare is going to be in the future. In some ways, it's kind of like a back to the future thing because
Yeah.
I grew up, my pediatrician was across the street. We knew them, they knew us. There was no, wait in a queue for 2 weeks to get a call back or 8 hours to be seen or, go to an urgent care and see somebody you've never seen before. That wasn't part of healthcare. And so I gravitated towards direct primary care because it sort of is the core values that I believe
Mhm.
are important to health and wellness are the direct relationship with the physician, the time in the room to get to know the patient. One of my
Right.
favorite patients she's a dog groomer, but she was getting these hand infections. She would always end up in the ER. And the only time I saw her with a hand infection, I was like, well, why are you keeping getting these hand infections? Sure, we can treat it. Sure, we can prevent you from going to the ER. Sure, that's all great. Here's some antibiotics. She sent me a picture of her hands. I was like, okay, let's start right away. And then you can come in.
Yeah.
But the truth is, it was because she was a dog groomer. And because I knew she was a dog groomer, I asked her, well, what's going on? Like, are you protecting your hands when they're getting wet and dry and cracked? Or what's going on with your hands at work? And it turns out she wasn't wearing gloves. And so just this simple
Yeah.
thing of like
Yep.
knowing your patient, knowing what's causing the problem, again, the root cause of the problem, and then just fixing the problem so that you're
Right.
preventing the issue. And so she actually hasn't had another hand infection in 2.5 years, which is amazing.
Wow.
And she's
Yeah.
just grateful, I mean, that's
Yeah.
the thing, like, they're just so grateful because that's so much time and money saved, and they're getting better care, and that's really what
Right.
it boils down to is I believe it to be better care and more
Yeah.
cost-effective care when we work through a direct primary care model.
Yeah, absolutely. I mean, obviously you're preaching to the choir with me, but that is such a good example too of when you're in a rush in your 7-minute appointment, you're just not going to ask those questions. You just simply don't have time. And even if you're the kind of doctor who would think to ask it, you just I remember thinking to myself that I didn't want to ask at the end of a visit, do you have any other questions? Because I was afraid they would say yes, and I didn't have time, and that's a horrible way to feel. And it's not what patients need, and it's not why we went into medicine, and direct primary care definitely offers a way to do it better. I absolutely believe that. I agree with you. Well, I'm so glad that wherever it is you heard it, I'm glad that you heard it. This is one of the great things about social media, I think, too, that we're all kind of hooked in with all of these people doing different things that we maybe otherwise wouldn't have met.
Well, and I think that's the key for me now is kind of building the direct primary care movement and working with other physicians. I mean, really, it's really key that we work together to educate the communities and to support each other because honestly, I believe that physicians really are ultimately the ones who will direct the best care in this country. And so
Yeah,
I think it's important that we take that leadership position.
yeah, yeah, I agree. Well, so tell me a little bit about how family practice DPCs tend to position themselves in the community. So obviously you get the word out and find patients, but I know that as opposed to really what we do in pediatrics, you also have a certain service that you can provide employers, but particularly small business employers with their benefits and what they're able to offer their employees. Can you tell me a little bit more about that and how it
Yeah,
works?
sure. So, in addition to offering family services and adult services, we really realize that there's a difficult time for employers to provide healthcare services at a reasonable cost that doesn't break the bank. We also know that for employers, recruiting and retaining is a really important thing right now, especially given the great resignation. So, we're really trying to make sure that they have an advantage by offering a healthcare offering that is maybe not the typical health insurance offering. In fact, our DPC employer groups receive unlimited access via phone, text, email to their physician directly, right? Unlimited appointments, there's never a copay, there's no hidden fees. So all the pricing is transparent upfront, which is a big deal, right? Because it's the
Yeah.
opposite of how we have experienced healthcare in this country for many years. And so, when patients come in and they can get a $3 blood count or a $3 cholesterol test or a medication for $3 to $5 a month, right? Because we dispense medications as
Yeah.
well. That's a huge savings out of pocket for the employees. And so employers are looking at this as an option for healthcare for their employees. Okay. And that's not just for full-time employees, but for part-time employees and for 1099 contractors. It's also an excellent option because the out-of-pocket expense can be really high for healthcare, especially if you have a high deductible plan. All of that comes out of pocket. So
Mm-hmm.
I've had a couple of patients who have a high deductible plan who need an MRI, and if they use their insurance, it'll be $4,000 out of pocket. And if they use the direct primary care MRI, it starts at $250 per
Wow.
MRI is the lowest cost. So there's a huge difference. And if you're paying out of pocket, I think easily the membership covers itself in a year. The membership ranges from $78 to $98 per month, right? And so it's
Yeah.
not a high cost, and the benefits are significant in terms of not just recruiting and retaining for employers and attracting talent, right? Because talented employees want benefits
Right.
and they're going to go to the best benefit plan, but they also can increase the productivity. So if you're at work and you don't have to leave work to go sit in the doctor's office to wait to be seen, or if you're homesick and you're not sure if you can go back to work because you don't know if you're contagious and you have to wait to be seen, those are all productivity issues for an employer and for a business and for an employee who doesn't want to use their PTO, right?
Right.
So if you could just call or text your doctor and get an answer, hey, yeah, you need an antibiotic or you need to come in and let's see you. Those are time saving techniques that, time ultimately is money. And so I think for employers and employees, we all want to be really conscious about how we're spending our time
Yeah.
and make sure that we're utilizing it to the best of our abilities so that we can live full productive lives, right? So
Right.
I think those are some of the key points that I talk to employers about locally.
Okay. Great. And what employers can do is they can include you as a benefit, paying for you and
Paying
your
for the healthcare
services,
services,
and
correct?
then also get a less expensive wraparound sort of catastrophic policy that they can offer their patients, because it is still important, if you can have insurance, to still have insurance, because there may be
There's
times
different
where
groups of employers. Obviously, we always want the patients to have insurance. And so each
right.
individual patient, whether they have insurance or not, when they come to the clinic, we're going to talk about the options.
Okay.
And for young, healthy people, if they don't have an option to get insurance, right, if it's not available to them, there's always HSA plans. And so those are health share plans, which
Mhm.
are a great alternative for people who cannot afford
Yeah.
insurance or who just want a cheaper alternative,
Right.
honestly, to insurance if they're young and healthy, because it will cover all the catastrophic things.
Right.
You can also choose a high deductible catastrophic plan to offer employees or to purchase on the marketplace. Again, that pairs really well with the direct primary care because then you're not spending that deductible and you're choosing a lower premium plan. The last thing I'll say is there are self-funded plans for employers where they also have like a stop loss gap insurance product that pairs with that so that they never come out of pocket more than X amount of dollars per employee, and they don't pay premiums into a health insurance plan, right? They actually are the health insurance plan. So
Mm.
if you get 85% of all your needs met in a direct primary care, and then you really only need catastrophic coverage for motor vehicle accidents, ICU stays, and you're really utilizing your direct primary care to stay out of the ER and the urgent care when you don't need to be there, most of the time you're not going to meet that mark and you're not going to end up coming out of pocket to meet
Mhm.
that stop gap loss. So there's a few
Yeah.
options for employers, but there
Yeah.
are some employers who really cannot offer any benefits at this point to their employees and remain profitable. And so this is a way to do that as well.
It's fantastic. And I think that is an important thing to understand, that this is not it's not for wealthy people. I mean, wealthy people can certainly take advantage of it, but it is for the every person. It is affordable, and it is often for the people who maybe are at a disadvantage and don't have access to these better healthcare plans that are out there.
Yeah. I like to call it concierge care at Netflix pricing. And truly, it is for
Yeah,
patients who don't have insurance, patients
yeah,
who have Medicaid, patients who have the, Blue Cross Blue Shield PPO Platinum plan. I have across the board patients who are
yeah,
interested in the services because it saves time and money.
right, right. Well, that's fantastic. So we have a saying in DPC, if you've seen one DPC, you've seen one DPC, because they are all different. Everybody makes their own DPC, what makes sense to them, and changes it over time. So tell me about your DPC and what makes it unique and how you've made it your own and kind of found your niche.
Yeah, sure. So I opened in 2020, July, in the middle of the pandemic, and I really like my office. I decorated it. Of course, it's really, it reflects sort of, it's got a lot of light, and it just feels really good to be there for me,
Yeah,
which is really important to me because I really advocate for self-care. I think it's really important that we take care of ourselves, that we spend time doing the things that we love to fill our cups.
yeah,
And, not just physically, emotionally, spiritually, like on every level, I believe that it's important that we fill our own cups before we come to help others. And that's
yeah,
true in my personal life and in my professional life. And so I'm always really prioritizing my own self care. And that was sort of part of the vision for creating the office space the way that it is. It's welcoming, it's inviting, it feels good. We have some, doTERRA oils that we use, and I feel good when I'm there, right? And it's a place I
yeah,
wanna be. So I
yeah,
think that's really important. I worked for many years in places I wasn't really, like, excited to go to, and so
yeah,
it drains your energy, and I think it's really important to keep your energy high, especially as a business owner. It's a big deal, right? Because it is a lot of energy is required to run a business, and so
right.
it is kinda like that part I really like. The other thing I'll say is, the connections, I think, for me are a huge thing. Making connections in the community, meeting people, other business owners, and then a lot of docs, right? A lot of doctors. So I've got 5 doctor patients right now, and
Nice.
I really like that relationship gives back to me, right?
Yeah,
I really enjoy taking care of physicians, especially,
mhm,
when we're struggling, and we've all struggled. And
yeah,
so just kind of having that ability to be able to care for others in a way that I feel like is really giving back. So I will say, I have been attracting a lot of moms and families, and I think it's because I've got kids and I'm a
mhm,
local mom and I'm a working mom, and so a lot of professionals can relate to kind of these strategies of time management and self-care and how, we balance our lives and not
yes,
perfectly. And
yes,
that's okay, right? And it's always a work in progress. It's never perfect. And I think when we give ourselves the grace to be in that space, that's where the real growth happens for
yeah,
us.
yeah. Well, and I can vouch for Dr. Diaz that if you need to vent, she's a very good person to vent to. I think you make people feel very comfortable very quickly, and it's just your personality. And I think that anybody would be lucky to have you as their physician.
Thank you.
And I just find it amazing. Like, I didn't realize that there were family practice docs out there who did appendectomies. Like,
Yeah.
that's new to me. Wow,
Yeah, out
so
in the
cool.
Wild West where there's really no doctors. And so
Yeah,
this is the
yeah,
funny thing about that rural emergency room is that no ER doc wanted to go work there because
yeah,
there was no backup, right? There was no anesthesia in case you couldn't intubate yourself. There was
right,
no fiber optic scope. So really,
right.
like, there was nobody who wanted to do these jobs. And so to be honest, like, there were probably people who might have been more qualified, but the truth was that I was the one who was willing and able. I had the skills and I had the confidence and I did it,
Yeah.
and that's just the way it goes. And so I guess, as funny as it is, I did know how to do at that time, like a cricoid.
Oh, yeah.
I guess I could have, but I never had to go there. I did end up, actually, I'll tell you, I spent a year overseas and I did an interosseous line there. And again, usually we do one or we see one, do
See one, do
one,
one, teach
teach
one.
one,
Yep.
right? And so for me, I was in the middle of nowhere with no other docs. There was no ability to have that experience. So it was
Mhm.
me, the book, and the phone, and the nurse, And we got it. We got it on the second leg.
Yep.
Like, yeah, that I
Yep.
needed to get it in, right? Because there was
Yep.
no other option. And we are all trained like this. When we really need to succeed, we
Yeah.
succeed.
Yeah.
And we do it for ourselves and we do it for patients. And this is just who we are. This is
Yeah.
what we are trained to do. And so I just look at this, DPC as a journey. I think the country's going on a journey with direct primary care, and doctors ultimately will be the leaders that they were born to be in the healthcare space. And I'm
Yeah.
really excited about it.
Yeah. It's very exciting. It's exciting to be a part of. And, I'm hoping that people watch this who are, potentially patients, but also potentially thinking about going into DPC. And one of the things that I have found that has been so wonderful is kind of what you were saying earlier, which is the community of DPC docs, of docs in general, but we in DPC, it's very, very supportive. We're not competitive. I mean, you and I are pulling from the same patient populations, from the same community, but we're not in competition. We want to build each other up because there's plenty of patients and we can only help each other, and getting the word out and having more people understand the benefits of this model and why it does make sense for them.
Yeah, and we're
And
becoming friends. I mean,
absolutely.
that's the amazing thing.
Right.
This is the
Right.
relationships that I think are
Right.
so important. And then I do believe it's an abundant universe. And I think if we can give to the next generation that is growing their DPC and be able to provide the tools necessary so that they never have to kind of do all the legwork that we did. No one should have to reinvent the wheel
Right.
again to start their clinic, right? There should be a
Right.
tool that they
Right.
utilize that makes it easy so that they can just jump into what they do best, which is serve patients.
Right. Absolutely. Ah, so I have a couple of questions a little bit off the topic, but I ask everyone. So one is, what is your favorite part of Chicago, living in Chicago? Just what do you like most?
So last summer, I started this habit of going on Sunday mornings down to the lake, taking my bike in the back of the minivan and just riding, right? And going north and going south and just kind of doing the lakefront. And all the years I lived here, I never really took advantage of that. And it's funny, I invited family, but they were doing their own thing and I would just go. And it
Yeah.
was so refreshing and beautiful and nice. And I did that as a self-care for myself, right? And I
Yeah.
really it really boosted me and it gave me the energy back to like think bigger, vision
Yeah.
bigger, like
Yeah.
enjoy life more, be present more, right? Be
Yeah.
here more.
You should do that with your patients. You should have a patient and doctor run club.
It would have to be biking. I don't run.
Oh, Viking. Okay. Viking then. Viking.
Walk.
That would be so cool. I bet people would love to do that.
That's
Well,
a great idea.
it's amazing how many people have answered the lakefront in some
Oh,
form or fashion. It really is. I mean, that is just something that is uniquely Chicago. There's a lot of cities with lakefronts, but there's something about Chicago's that's really pretty special.
beautiful. Mhm.
Okay, next question is, if you had a chance to go back and talk to your 20-year-old self, what would you tell her?
Oh, wow. What would I tell my 20-year-old self? I think I would just let myself know that, it's funny, my dad passed in 99 and I read the letter that he wrote me when I was in college. And at the
Mm,
time, it didn't make as much sense to me. But
mhm,
later, now in 2020, when I was opening a practice and, things were very unclear and unsure, I
mhm.
had sort of an ability then to go read those letters again for the first time in many, many, many years. And it was
Yeah,
almost as if they had been directly written to me at that time. And I guess it is the
wow.
word, it is the encouragement that I would have given myself.
Yeah,
Although I don't think I necessarily could have received it at 20. And it
right.
was, you will be successful no matter what you do. And that, the world needs more scientists and, technology and, you're going
Right.
to be of great service to the world. And so I think that would have been my advice is that I'm going to be successful, right? And to believe in myself and
Yeah,
those dreams that I had when I was 20 that really I could fix the healthcare system,
yep, yep,
and then just believe it, right? I believe
right.
it now, but I'm I'm not 20 anymore.
Right. It is interesting how much you learn over time just through experience. Well, hopefully you will instill those things, those thoughts and mindsets to your own children and your patients. So this has been fantastic. I just
Thanks.
love hearing about other people who are doing DPC and how everybody's doing their own little thing. Everybody's doing it just a little bit differently. So, if somebody is looking for either a primary care physician in the western suburbs of Chicago, or is looking to just pick your brain and learn more about DPC, how can they find you?
Yeah, thanks. First of all, I just want to say thanks. I really, really appreciate you as a friend and as a nearby business owner. And, I think it's just been a phenomenal relationship to build. So thanks.
I agree.
And you can reach me at 708-613-7916. Just send a text. You can go to my website at www.rootshealthdpc.com, or you can send me an email at drdiaz@rootshealthdpc.com.
All right, easy peasy. I will put all of that, the notes for on the YouTube channel where this will be housed. This is broadcast live, but actually pre-recorded. So if anybody does have any questions, you can also just drop them in the comments and we will get notified and be happy to answer any of your questions on the fly as well. So thank you so much, Dr. Diaz. I really enjoyed our chat. And thank you, everyone else, for tuning in. Please spread the word. The more people who know about this movement, the better. Even if it's not for you, it might be for your friend or your boss or somebody else. So spread the word because it really is a very special and important way of providing good care, especially in this day and age where things are so depersonalized. It's a really great way of getting back to, just like Dr. Diaz said, that doctor-patient relationship, which is why we went into medicine and I think what most patients are looking for. So have a wonderful weekend. Have a wonderful Mother's Day. Happy Mother's Day.
Happy Mother's Day to you
Thank
too.
you. And thank you for joining us on Keeping in Touch. Bye-bye.
Bye.